And finally, the last exam will be the European Board of Ophthalmology. I think my colleagues here from Europe would be quite familiar with it. So the pathway is quite short. First of all, you need to check your eligibility, as this is the crucial part here. It is not like an exam open to ophthalmologists worldwide, as with the Royal College exams. It is only open to ophthalmologists in Europe, and every country has a certain eligibility criteria. So you need, for example, head of department approval and other eligibility criteria. So you would need to check with the website what is the requirements based on your country. Once you are eligible, it is just one exam. And this exam, you get examined in everything. So you do MCQ exams, single best answer exams, and the clinical viva, which means that it is just the clinical stations, but in form of oral discussion. Once you clear these exams, you get the title FIBO, or Fellow of European Board of Ophthalmology, which you will be then required to apply for subspecialty exams. You remember subspecialty exams similar to the ICO and the FIOF? There is also subspecialty exams for the European Board, which usually require 1 to 2 years experience. Again, there are different requirements per exam. So you need to check which exam you want and what is the certain requirements for this exam. So what is the format of this exam? It is a written exam, 60 questions in 2 hours. It used to be a negative marking in this exam, but this is no longer the case. And the viva clinical cases, so you in 4 stations, can be either on site 60 minutes or online in 80 minutes, and you will be asked on different sorts of clinical cases and how would you manage these cases. So it is not as extensive and as demanding as the Royal College exams. It's quite easy exam. Like for all my candidates who did the European Board exams, they all tell me the same thing, that Royal College exams are much harder. So they can be done online, on person, depending on the diet. There are several diets throughout the years in summer and autumn, and some of them can be online, some of them can be in the autumn. So you need to check in the website, and the fees is 600 euros. So what is the pros and cons? The pros, the advantages: it is a recognized European diploma for eligible candidates. It is the exit exam, like FRC of it is the exit exam for UK trainees, UK candidates. Then the EBO is the equivalent to in Europe. This is the exit exam for European candidates, for European trainees. And there is availability of person and online diets. Some people get like really stressed with in-person discussion, so they can provide you some online diets. And it is a gateway to PHEBUS subspecialty. So if you want to be recognized in certain subspecialty, then this will be, you need to clear this PHEBU first if you are in Europe, then do the subspecialty exam. Of course, that the challenges is that the eligibility is not universal. So it is not open to all ophthalmologists throughout the world. And comparing to ICO subspecialty exams or the FIOF subspecialty exams, the EBO subspecialty exams can be more demanding. Like they can require lookbook, they can require, for example, a record of your cases, like for cataract surgery. They can require fellowship training. So it is not like just you are passed an exam and you become an eligible. No, you will still need to fulfill other eligibility criteria. And the online exam requires reliable tech, as if you are doing an MCQ exam, it should be fine. But if you are doing a face-to-face exam and then the internet connection is interrupted or it is not reliable, then there will be lag, there will be delay, you will be cut off, and then it can waste you a lot of time and nerves. So it can be quite stressful. So you need to think about that if you are going to do this exam. I personally would prefer a face-to-face oral exam rather than online exam. All right, so what is the exemption? Well, FIBO will unlock the eligibility to the EBO subspecialty, as we said. And if you are, this is the good news, is if you don't live in Europe, then, and you want to do the FIBOs, you want to do the FIBO subspecialty exams, you can clear the FRC of first, and then do the subspecialty exam. But again, you need to check in the website, as every exam has different requirements.